lost my desire for sex and it bothers me. I feel like a part of me is missing. I'm concerned, frustrated, and worried. I feel like I'm letting my partner down. I think maybe it's my fault because I'm stressed or my hormones are changing. Why don't I do something about this? It's time I talk with my doctor.
Hypoactive sexual desire disorder, or HSDD, is defined as a persistent or recurrent deficiency or absence of sexual thoughts, fantasies, and/or desire that causes marked distress. When these symptoms persist for 6 months or more, intervention is justified. It has been recognized for more than 4 decades. In the US, HSDD occurs in approximately 1 in 10 women, making it almost as common as migraine in the general population. Clinically, no identifiable hormone measures characterize premenopausal women with HSDD. Hormonal differences cannot separate women with HSDD from those without HSDD. Like most women, women with HSDD have normal hormonal and menstrual cycles with the appropriate elevations in estrogen and testosterone around the time of ovulation. However, unlike women without sexual dysfunction, who experience an increase in sexual desire at the time of ovulation, women with HSDD do not. They experience a chronic lack of desire for sex across the month and for many months.
To understand why women with HSDD do not experience the same level of desire for sex that women without sexual dysfunction do, despite normal hormonal changes or levels, we need to appreciate and visualize the brain's response to erotic cues. Activation of certain brain areas is visualized with neuroimaging. This activation may correspond with the excitation in neurochemical systems, mostly dopamine and norepinephrine, in response to erotic cues. Here, we see brain excitation, indicated in red, during the presentation of erotic stimuli in women without sexual dysfunction. In addition to the activation of excitatory neurotransmitters, there are other neurotransmitters, such as serotonin, opioids, and endocannabinoids, indicated here in blue, that may play a role in diminishing the sexual response. In HSDD, there may be underfunctioning excitatory systems, overfunctioning inhibitory systems, or some combination of the two, resulting in a subdued response to sexual cues, not enough excitation, or too much inhibition. Let us look further into the brain and explore how these various regions work to modulate sexual arousal and desire. Activation of dopamine and norepinephrine systems cause desire and build excitation for sexual interaction. In the hypothalamus, dopamine release is stimulated by melanocortins and testosterone. Inhibition is modulated by serotonin and prolactin. While melanocortins can cause excitation in dopamine neurons, resulting in an increased release of dopamine from the neuron, serotonin acting on other receptors can cause inhibition. Overactivity of the serotonergic inhibitory system is believed to result in sexual dysfunction across all phases of the sexual response cycle. Together, these systems of the brain interact with peripheral erogenous areas of women in preparation for and during sexual activity.
Precise neurochemical alterations or imbalances that can lead to HSDD remain to be fully elucidated. More research into the mechanisms behind HSDD is needed. Recognition of this distressing disorder and ensuring appropriate diagnosis are important first steps in counseling patients. Screening and diagnosis can be made using the DSDS, or the Decreased Sexual Desire Screener. The DSDS is a validated 5-item questionnaire that is completed by the patient to help the clinician diagnose HSDD and identify possible modifiable causes. 4 of the 5 questions on the DSDS are yes or no. The last question is essentially a short, focused review of systems targeted at sexual concerns. Importantly, for the busy clinician, the DSDS can be completed in a matter of minutes.
I'm so glad my doctor knows what this is and is comfortable talking to me about it. My lack of desire is not my fault, and it has a name. It's called HSDD.
This video is brought to you by AMAG Pharmaceuticals.